Okay, so here's our second subsection on extracardiac diseases. And the extracardiac diseases that we'll talk about today are pericarditis, pericardial tamponade, and pulmonary embolism. Okay, so the first one is pericarditis. The pericardium is a thin-walled sac that surrounds the heart, and it's filled with thin pericardial fluid of about 30 to 50 cc's. When the pericardium gets inflamed, due to factors such as trauma, infection, or autoimmune disorders, then the pericardium causes electrical changes on the ECG. Because the pericardium surrounds the whole heart, it isn't surprising that with pericarditis, you get changes in multiple leads and multiple distribution patterns. The hallmark of pericarditis is ST segment elevation in multiple leads and PR segment depressions in the same leads. So here you can see diffuse ST segment elevations in multiple leads and multiple vascular distributions. And then here in the purple, you can see PR segment depression. So this is the hallmark of pericarditis. So on tests that you'll have, pericarditis is often mixed with answer choices of ischemia. So in this situation, you really need to think about your groupings of different leads, like the lateral leads, which are leads 1, AVL, V5, and V6, or the anterior leads, which are V1 through V4, for example. If you're having multiple distributions affected with PR depression, you may very well have pericarditis and not ischemia. This is important to test examiners because the treatments and the prognosis is vastly different. In a patient with pericarditis, maybe they had rheumatoid disease or renal disease, and then you see the ECG. Don't choose ischemia if the story is more suggestive of pericarditis. Our next extracardiac disease is pericardial tamponade. So in this situation, instead of inflammation, like as in the last example, in pericardial tamponade, we now have fluid around the heart. And this fluid can be small or massive, with several liters occupying the pericardial space. The hallmark of pericardial tamponade on the ECG is a low voltage ECG. Sometimes when the heart is swinging in the thoracic cavity, you can have electrical alternans, which is when you have a tall QRS and then a shorter one, and then a taller one in an alternating pattern. And this is our third ECG in this section, and that's pulmonary embolism. The problem with pulmonary embolism is that the most common ECG abnormality with this disease is usually sinus tachycardia, so it's usually pretty nonspecific. However, for testing purposes, they're going to give you a classic S1, Q3, T3 pattern. I'll say that again. S1, Q3, T3. So S1 simply means that the S wave portion of the QRS is really prominent in lead 1. And Q3 means that in lead 3, the Q wave is really prominent. And T3 means that in lead 3, the T wave can be altered, it can be inverted, and although in this example of PE the T wave wasn't perfectly inverted, you get the picture here. So this pattern is not all that common in PE, but when you see this pattern and it's coupled with classic symptoms of shortness of breath, dizziness, chest pain, and lightheadedness, and maybe some tachycardia, then the examiners are screaming to you that this is a pulmonary embolism, and they will want you to image with a contrast CT or other imaging modality and choose a more aggressive management plan with heparin and/or thrombectomy. Okay, so that's the end of this section. I hope you found it helpful.